Hey there. If you're a dog owner, you know that keeping our buddies healthy is job number one. We're going to talk about something that sounds pretty intimidating, but I promise it's absolutely manageable with the right info. We're talking about diabetes mellitus in dogs.
Have you noticed your dog has basically moved in next to the water bowl lately? Or maybe you're dealing with accidents in the house all of a sudden. It's definitely worrying, but those are really important clues. So in this explainer, we're going to break down what diabetes is, what signs to watch for, and most importantly, how you and your vet can team up to give your dog a long, happy, super active life.
All right, so what exactly is diabetes mellitus? Well, at its heart, it's a disease that involves a little organ called the pancreas. Now, the small organ has a huge job. It produces a hormone called insulin, and insulin's whole purpose is to manage the amount of sugar or glucose in the blood. When a dog has diabetes, something's gone wrong, and the pancreas just can't do that crucial job anymore. You know, the easiest way to think about this is that insulin is like a key. Its job is to unlock the door to all your dog's body cells, letting the sugar from their food get inside to be used as energy. But if you don't have the key, well, that sugar gets locked out. It just piles up in the blood to dangerous levels. And meanwhile, the poor cells inside are literally starving for fuel. So, you're probably wondering, could this happen to my dog? Let's talk about who's most at risk. And it's really important to hear this. It's often because of factors that are completely out of your control as an owner. So let's take a look at some of the main risk factors. Okay, so age is a big one. It's most common in dogs that are middle-aged to senior, 5 years and up. Gender can play a part too. Unspayed female dogs are actually twice as likely to get it because of hormone cycles that can mess with insulin. And while truly any dog can develop diabetes, genetics are definitely a factor. Breeds like Samoyeds, miniature Schnauzers, and Terriers seem to be more prone to it. And yeah, just like with people, being overweight can make the body's cells less responsive to insulin. And this is where you come in. Seriously, what you notice at home is the single most important first step in all of this. You know your dog better than anyone. Spotting those little changes in their routine early on can make all the difference for getting a diagnosis and having a great outcome. So what are you actually looking for? There are 4 classic signs, and they're all connected. First up, they're drinking a ton and peeing a ton. This is because the body is desperately trying to flush out all that extra sugar in the blood through the urine, and that just pulls a lot of water out with it. The other 2 signs are a little weird together. A huge, ravenous appetite, but at the same time they're losing weight. And that's the strange paradox of diabetes, right? Their cells are starving, so the body starts breaking down its own fat and muscle for energy, even though your dog is eating you out of house and home. Here's another thing you might actually see. Take a close look at your dog's eyes. Do they seem a little cloudy? That's not just your imagination. High blood sugar really messes with the lens of the eye, causing cataracts to form. And it can happen really, really fast in diabetic dogs. It's actually a super common complication. Okay, so you've noticed some of these things. The next step is to call your vet. I know this can be a really stressful time, but just knowing what's coming can help a lot. And remember, all those things you noticed at home, they're the vital first clues your vet needs. The good news is diagnosing diabetes is pretty straightforward. Your vet's going to start by just listening to you. All those observations you made are gold. Then they'll do a full physical exam, and finally, they'll run some simple blood and urine tests. And that's how they confirm it. A diagnosis is made when they find high levels of glucose in both the blood and the urine, and it's sticking around. Really, diabetes is the only common disease that causes that exact combo. Look, getting that diagnosis can feel like a gut punch. I get it, but I really want us to shift gears now and talk about management and hope. This is not an end. It's the beginning of a new routine, a totally manageable one, that's going to get your dog feeling so much better and let them live a long, full life. So, how do we do it? Well, successful management really stands on 4 legs, like a sturdy table. You've got daily insulin injections, a consistent and controlled diet, a regular exercise routine, and finally, just keeping a careful eye on things at home. All right, let's talk about the elephant in the room, the injections. I know, that's the part that freaks most people out. But I need you to hear this. It is so much easier than you think. The needles are teeny tiny, and the shot just goes right under the skin. Honestly, most dogs barely even flinch, especially if you follow it up with tons of praise or a good scratch behind the ears. It really does become just another normal, no big deal part of your day, super fast. So what does a day in the life look like? It's all about one word: consistency. A typical routine is pretty simple. 2 meals a day, about 12 hours apart, and right after each meal, they get their insulin injection. A little bit of consistent, moderate exercise, like a nice walk, also helps the body use that insulin better. This strict schedule is what stops those blood sugar levels from going on a wild roller coaster ride. Now, while we're focused on keeping high blood sugar down, we also have to be smart about the flip side. What if it drops too low? This is called hypoglycemia. It's definitely the most serious potential complication of treatment, but the good news is it's something you can be totally prepared for. So it's absolutely crucial you know what to look for. If your dog suddenly seems really weak, or they're wobbling around like they're drunk, or maybe even twitching, you need to act fast. Your emergency first aid is simple. Get something sugary, like honey or corn syrup, and rub it right on their gums. The sugar gets absorbed really quickly that way. And then, your very next step is to call your vet for emergency advice. Don't wait.
I really want this message to sink in. Once a dog's diabetes is properly regulated, their prognosis is good. It's really good. Most of them go on to lead long, happy, wonderful lives. The magic words in that sentence are properly regulated and consistent. That's the whole ballgame.
Okay, we have covered a ton of information, from what's happening inside the cells all the way to a daily schedule. So let's boil it all down to the one key thing I really want you to take away from all this.
Yes, diabetes is a serious condition. There's no sugarcoating that. But it is not a death sentence, not even close. It is so manageable. And the key to your dog's long, happy life, it's you. It's your consistency, your commitment to that daily routine of feeding, injections, and just paying attention. That is what makes all the difference. Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.